Well, there's an epidemic of arthritis and back difficulties in America. That's because we have 80 million baby boomers come along. They have 72 joints each, and they've listened to the medical profession since they were born. Of course, the medical profession says, oh, just eat well, you get everything you need, you don't need to take supplements, you got expensive urine, you're wasting your money, you can overdose, interfere with your drugs, and then they say, be sure you exercise. So it's like running your car around the block at 200 miles an hour, but don't put any oil in it, it's unnecessary expense. I mean, come on, why put oil in your car? And so that's what has created this epidemic of arthritis and back problems. So what I want you to do is get a hold of the book, Dead Doctors Don't Lie. I want you to get a hold of the book, God Bless America. Particularly baby boomers need that set of books, Dead Doctors Don't Lie and God Bless America. They deal with the fraud that's been perpetuated against the American public by the orthopedic surgeons. Let me tell you, cartilage is rebuildable. Discs are rebuildable. Bone is rebuildable. These are dynamic living tissues, and they will repair themselves given the right raw materials. Drugs and surgery do not cause regrowth. Now, let me tell you, in July of 2002, the Harvard School of Medicine, the orthopedic department, did a 20-year study, or published a 20-year study in the New England Journal of Medicine. As Harvard Medical School published in the New England Journal of Medicine a study in which they said surgery, knee surgery and hip surgery for arthritis is useless. Knee surgery and hip surgery for arthritis is useless. Hello? That was 2002. And orthopedic surgeons are still doing joint replacement surgeries as bread and butter surgeries. Well, how many of you heard of 1-800-BAD-HIP? Okay, that's because what's happening here is the prostheses, the joint replacement things for your knees and your hips break down and cause billions, not millions, billions of dollars worth of settlements, lawsuits. And guess what? You're the taxpayer paying for it. Medicare, Medicaid have to pay these settlements. They have to pay for these redos and so forth. It's a mess out there because replacement surgery for knees and hips when you have arthritis is useless, according to Harvard Medical School, and expensive and dangerous. Then, 4 years later, in 2006, Harvard Medical School published in the Journal of the American Medical Association back surgery for low back pain, sciatica, degenerative disc disease, peripheral neuropathies, and restless leg syndrome are useless, and dangerous. So what I want you to do is contact your FDI Longevity Associate, and ask about the 90 for Life Crusade. Ask about the 90 for Life Crusade. Say, what can you do for me? You know, my doctor wants me to get a knee replacement, hip replacement, wants me to do back surgery. And I understand there must be other options because Harvard Medical School said that these procedures are useless and dangerous. Say, well, yeah, what we want you to do is look at getting rid of the bad stuff out of your life, and your FDI Longevity Associate can teach you how to do that. You'll save a lot of money by getting the bad stuff out of your life. That's what got you in trouble. And then you must supplement with the raw materials necessary to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And I personally like the Healthy Start Pack. Contains 3 products, and one Healthy Starter Pack is designed to supply enough of the nutrients for a 100-pound person for a month. So if you weigh 150 pounds to 200 pounds, I would take 2 Healthy Start Packs per month. If you weigh 175 to 225 pounds, I would take 3 Healthy Start Packs per month if you have joint problems, back problems. If you don't have any problems, then 2 Healthy Start Packs will be enough for maintenance. Then you also need to throw in what we call Glucogel or Fucoid Z. Glucogel and Fucoid Z are raw materials designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And so the approach we like is the Healthy Bone and Joint program, which is the Healthy Start Pack and the Glucogel. And so contact your FDI Longevity Associate. Say, okay, I'm in for that 90 for Life Crusade. I don't want to get joint replacement surgery. I don't want to get back surgery. I lost my health benefits. even though I'm working, my employer has taken my health care benefits, and so he's gone that direction. So I'm dangling out here without the ability to have insurance pay for my joint replacement surgeries. Well, give us 90 days. See what we can do for you in 90 days. Give us 90 days, and we'll give you the Mighty 90, the Almighty 90, the 90 for life. We'll introduce you to the glucogel, all of which that program together is designed, based on body weight, is designed to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makeshift bone itself. Now, the books Dead Doctors Don't Lie and God Bless America are designed to share with you everything you can do, again, to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between your vertebrae, bone, makeshift bone itself. If we fail you after 90 days, you can always get the surgery, can't you? If you go for the surgery first, you can't always get unsurgery, uninfected, unparalyzed, and undead. Stick with us. We'll be back with more truth, justice, and the FDI Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk a bit about the doctors today.
The doctors.
Got a story from CNN Money headlined, "Doctors Going Broke." And they say it's an embarrassing secret traveling nationwide that a wide range of doctors, from family physicians to cardiologists to oncologists, are going broke. They say industry watchers have been watching the trend. As they say, half of all doctors in the nation operate private practices. So in this cash crunch, these independent practices could be going away in many communities, leaving these communities without vital health care resources. According to Mark Lyon, he's a CPA that advises independent doctor practices about their money. Says a lot of independent practices are starting to see serious financial issues. And they outline one doctor here, Dr. William Pence. He's a cardiologist in Philadelphia with a private practice. They said that he actually had to take out a private, a loan, an SBA-type loan, in order to make his payroll. And like you and I mentioned about off the air before we got started here, that, what about next month? And he says that what's causing this is the steep cuts to Medicare reimbursements, 35 to 40% on cardiovascular services such as stress tests and echocardiograms and, all of these pre-screening tests. And as you and I have talked about in the past, that was their way of, as you say, milking the system.
Gaming or milking the system, exactly right. To get
more money out of the government just to pad and line their own pockets. And, so they say they're... Total, this guy says total he's down about 9% compared to 2010. They say that these cardiology practices have been destabilized because about a third of their patients are Medicare patients, and it's these cuts to Medicare that's really getting into their wallet here. They say that an impending 27.4% Medicare pay cut for doctors is possibly set to go through. In fact, it was actually supposed to have already happened. But lawmakers gave it a little bit of a boost by a patch for a couple of months where they blocked the cuts from happening. And apparently over the last decade, that's happened 13 times. No wonder the government's broke if they're continuing to pay these overpriced doctors for these services that they claim they need to do, but it's really just a way to milk the system. And they go on to say many of them are too proud to say they're on the verge of bankruptcy. And they talk about one specific doctor, Dr. Neil Barth, who's an oncologist, and he was actually rated in the top 10% of oncologists in the U.S. News top doctors ranking. He may be forced to close his 31-year clinical practice and force 6,000 cancer patients to look for a new doctor. So there's 6,000 lives possibly saved. And they go on to say, he says, at one point, I grew up in a system where I was spending $1.5 million a month on buying treatment drugs for cancer. And what they're talking about is these expensive, targeted cancer drugs that they buy from the pharmaceutical industry for pennies on the dollar, real cheap, buy them in bulk, and then they, quadruple or raise the price to the patient by 300 or 400%. But if you're getting disparaged that you're afraid your doctor may go out of business, be advised that one doctor already, a family physician, Dr. Mike Gorman in Nevada, has actually found a way to continue to bilk the system. As he says, I will see more patients, but I won't check all their complaints at one time, because if I do, insurance will bundle the reimbursement into one payment, so I'll have to make them come back for multiple visits. So, they're already finding ways to bilk the system and continue to get money.
Well, an option is for everybody in America to go to their state legislators and make naturopathic medicine very economical, very effective, very safe. We don't kill people. Remember, I'm a naturopathic physician. Naturopathic medicine should be legalized in every state in America. And guess what? The medical doctors go away and we'll save lives. What a concept. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to North Carolina. And Greg, you're on with Dr. Wallach.
Oh, Greg, you're on the air.
Hey, Dr. Wallach, how are you doing?
Fine, sir. Thank you. How can I help you?
Yes. I've got two questions. The first is in regards to the amount of, let's say, Healthy Start, individual weighing 200 pounds, but their budget is going to only allow them to get one of them. Want to know the impact of that. And next is in regards to individual who's suffering with chronic.
Okay, well, wait a minute. Is that the second question?
Yes,
well, hold off on the second question. Let me answer the first one first. What happens is if a person cuts their dose by 50% because of budgetary reasons, they're still going to get enormous benefit. However, instead of a benefit showing up in 2 to 4 weeks, it might take 60 to 90 days. And so the benefit period is going to appear down the track as opposed to sooner. And a lot of people lose patience. They say, well, I've been doing this for a month and I'm not seeing anything. Well, if you take half the dose, that is more likely to happen. And so what I urge people to do is to help other people see the benefits of the FDI Longevity 90 for Life crusade. Get on the Almighty 90, and help them do that. And when they see that as they buy their own products, we'll send them a check for more than they're actually spending. And it'll be a wash, plus they'll have a little left over for some gasoline money. Okay, so that's the question and answer for number one. What now? Tell me about number two.
Okay. For number two, someone who's dealing with chronic hepatitis C.
Hepatitis C, okay.
Yes, and they no longer want to do the liver treatment. Enzymes are elevated, but now want to find a natural way to restore function of their liver.
Okay, how much do they weigh?
190 pounds.
Okay, well, they would need 2 Healthy Start packs per month. Okay, that's 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. All that will be accomplished by the 2 Healthy Start packs per month. They're going to need 6 selenium a day. That's our ultimate selenium. 2 at breakfast, 2 at lunch, 2 at dinner. That's 2 bottles a month. They need the de-stress capsules. They're going to need the de-stress capsules, 3 of those twice a day. That's 2 bottles a month. And I would also have them take the Killer Biotic, which is a blend of herbs that support the immune system as well as have antimicrobial properties. 9 of those a day, 3 at breakfast, lunch, and dinner. If they're a coffee drinker, have them drink our JavaFit Immune Coffee. It has extracts of 14 immune-supporting mushrooms. JavaFit Immune Support Coffee. JavaFit Coffee. Wow. Okay, well, we'll be back with more Truth, Justice, and the FDI Longevity Way and the 90 for Life Crusade after these messages.
All right, let's head to Owings Mills, Maryland, and Delphia. You're on with Dr. Wallach.
Delphia, you're on the air.
Good afternoon, Dr. Wallach.
Hi, how can I help you?
I have a female, 13 years old, 95 pounds. She's within her first year of her menstrual cycle.
Okay.
She has severe cramps. She vomits for the first 2 days. Every hour or so, she's vomiting like an adult. She can't keep anything in her stomach. She's out of school for 3 days every time it appears.
Mm-hmm.
She sleeps the entire 3 days. Her doctors even went out and gave her a pregnancy test because she has all the signs, but she's not pregnant. She has not eaten in 3 days. Her face is bumpy. Now that we're coming to the end of the 3 days, she's starting to spit, but she has severe cramps in her stomach.
Okay.
And as we near the end, she's crying all morning and asking for someone to please help her.
Okay, I get the drill here. Does she have any other health problems like asthma or anything like that?
Only thing she has is eczema.
Eczema, okay. All right. When you have eczema, this means that she has a gluten intolerance, and so she needs to go on a gluten-free diet. Absolutely no wheat, barley, rye, or oats. No wheat, barley, rye, or oats. No wheat, barley, rye, or oats. And I said it 3 times for emphasis. And this is oftentimes difficult for teenagers to accept that they're gluten intolerant. But if she has eczema, she has gluten intolerance. That means no wheat, barley, rye, and oats. That means no cereals, no pasta, no Pop-Tarts, no Pillsbury toaster strudels, no pancakes, no waffles, unless they're made from rice or millet or buckwheat, which is not wheat. So she's going to have to learn how to live in the gluten-free aisle in the various grocery stores. All grocery stores have gluten-free aisles now because 30 to 80% of all Americans, depending on the city, have gluten intolerance problems. No fried foods, no processed meats, no oils whatsoever. What that means is this. I'll also want her to get on a program that's going to deal with what's called dysmenorrhea. She has, you put a name on all this sort of thing she has. She has gluten intolerance, but she also has dysmenorrhea. So I want her to take what we call the Healthy Start Pack. At 95 pounds, she's going to take 1 Healthy Start Pack per month. It'll be divided in half of each of the 3 products at breakfast, and the other half at dinner. And hang on, we'll give you the rest of her program after these messages. And Doug, let's just go right back to Maryland and Delthea. Okay, so we got the 1 Healthy Start Pack for this young girl with dysmenorrhea and cramps, and she also has gluten intolerance. So, again, just briefly, absolutely no fried foods, no oils, cooking oils, mayonnaise, salad dressings, absolutely no processed meats with nitrates and nitrites. They have a lot of wheat in them, no gluten whatsoever, and that's a process in itself. She should be given the Serial Killer CD to listen to. Serial Killer, the CD, will go through that gluten intolerance thing very thoroughly, and so even teenagers will understand what they need to do. And then, supplement program, she needs the 1 Healthy Start Pack per month. That's a half a dose of each of the 3 products at breakfast, a half a dose of each of the 3 products at dinner time. Then she needs the B vitamins called de-stress capsules. I want her to have 3 of those twice a day. It's 2 bottles a month. I also want her to get an extra bottle of our OsteoFX Plus calcium, a quart of it, and take an extra ounce of the OsteoFX Plus each night at bedtime with a glass of water. For the dysmenorrhea part specifically, I want her to get what we call Woman's FX, and I want her to take a half an ounce, which is a tablespoon at 10, a tablespoon at 3, and a tablespoon at bedtime. So that 1 quart will last about 3 weeks. So she's going to have to go through 2 quarts a month of the Woman's FX, which is a herbal blend designed, it was actually a 150-year-old formula. It's designed to deal with dysmenorrhea and all these symptoms you described. Okay, Doug, let's go to callers.
Let's head to Michigan. And David, you're on with Dr. Wallach.
David, you're on the air.
Yes, I'm on right now.
Yes, sir.
Yeah,
you're on. How can we help you?
Yeah, I just want to let you know I've been taking the products for like more than 2 weeks now. And I just want to let you know the results. Right now, I've seen a little improvement. I was wondering.
Okay, well, first of all, stop. Why did you start taking a program, a FDI longevity program?
Anxiety disorder.
Oh, okay, very good. Okay, now, so you've seen some slight improvement, and how does this improvement show itself? I mean, what improved?
Okay, I used to have anxiety attacks like somewhat in the middle of the day. Now that stopped. I'm still having anxiety a lot, but that stopped. Like the anxiety for no reason. Like it would be a major attack. Like my face would even be numb. Mm-hmm. Now, like that's gone.
Good.
But, like I want to know, like when will I like completely be rid of this? You know, I've had this. I could have sworn I've had this since I was 9.
Yep. Well, it's possibly had since I was 9. Okay. Well, here's the deal. How much do you weigh?
I weigh about 158.
Okay. And how much and what are you taking? What are you taking? What's the dosage?
Okay, I'm taking all of them. I'm taking the de-stress capsules 3 times a day.
Okay.
The Ocean Gold 2 times a day.
Okay.
And the Healthy Start Pack 2 times a day.
Okay, good. All right. Well, you've shown a major improvement in one category. And have you noticed any, maybe, so you're saying, well, maybe this is a little better, maybe it's the same, I don't know, but, it's not getting worse. Or, is there anything you can say about any of the other stuff?
Okay, nope, it's not getting worse. It's not getting worse.
Okay, good. So that's progress. It's not getting worse. That's something. Okay, so we need to look at your diet and make sure that you're on a gluten-free diet, no wheat, barley, rye, or oats, no fried foods, no processed meats with nitrates and nitrites, because processed meats have a lot of sugar in them, which you need to avoid. No sugar whatsoever.
Yep, I've been avoiding all that.
Okay, good.
I've only been on brown rice.
Okay, and you're eating vegetables and eggs and meat and that kind of stuff.
I'm not eating that much eggs, and I'm still eating. I'm eating organic meat,
that's fine.
beef.
Organic beef's fine, but I do want you to eat about 4 eggs a day. I'd like you to eat 4 eggs a day. They just cannot be fried. And a lot of this has to do with making sure that you bridge the gaps, because if you're not taking in protein frequently enough or fats frequently enough, your blood sugar will still be up and down all over the place. And so I want you to make sure that you're having at least 4 eggs a day. Cannot be fried, cooked in oils or margarine. Cannot be cooked in oils or margarine. I do want you to use mixed fancy nuts without the peanuts. Mixed fancy nuts as snacks during the day. And certainly before bed, I want you to have a couple of scrambled eggs in butter and some nuts before you go to bed. And then I want you to call me back within 2 weeks. You're welcome to call back anytime, but call back. Don't wait longer than 2 weeks, because I want to know how eating the scrambled eggs and the nuts at bedtime help you in the morning, okay?
Yeah, and can I have honey? Is it
no honey, it's sugar. No honey. Until we get rid of the anxiety, you got to be totally sugar-free. No fruit juice, no dried fruit, no fresh fruit, no honey, no molasses, no agave syrup, no maple syrup, no corn syrup, no sugar, natural processed. Barbecue sauce, cereals, just no sugar whatsoever. None of the rice milk, almond milk, cashew milk, soy milk, they're all just loaded with sugar. Have to stay away from them all. Okay, Doug, let's go to callers.
All right, let's head to Colorado. And Barbara, you're on with Dr. Wallach.
Hello, Barbara, you're on the air.
Well, thank you, Dr. Wallach.
You bet.
I'm calling about my mother-in-law and myself. My mother-in-law is 85 years old, and her memory is really going bad. They have her on, Pravestin and simvastatin, and it's a diltazen, and I've researched them, and I noticed that they have her on too many statin drugs, but she's just losing her memory, something awful.
Yeah.
Go ahead.
Yeah, okay. Is she in a nursing home or is she at home?
Oh, she's at home. She's a perfectly healthy individual. She's
well, the reason I'm asking that, because if she's in a nursing home, they're not going to do the nutritional stuff. Okay, but if she's at home where you have control of it, then you can help her. Okay?
Yes.
So she needs to get rid of all the bad stuff out of her life. There's 4 different dementias where people lose their memory. There's 4 different major ones. There's no rule that says a person cannot have 2 or 3 or all 4. Okay, so nutritionally, I like to approach all 4 at the same time. So what does your mother-in-law weigh?
About 125, and she's about 5'2".
Okay. So I would give her, or first of all, let's get her off all the bad stuff. Nothing bad. That means no fried foods, no oils. That means margarines, salad dressings, cooking oils, mayonnaise. Canned fish has got to be packed in water instead of oils. No processed meats with nitrates, nitrites. That means deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, hot dogs, all that stuff's got to go. And then the supplement program goes like that: no sugar. If I didn't say it, no sugar, natural or processed. Okay? Then the supplement program for 125-pound lady is going to be like this: 1 Healthy Start pack per month. That'll allow her to have 1 tablespoon, which is a half ounce, of the Osteo FX Plus at breakfast and dinner, 1 scoop of the Beyond Tangerine NutriCrystal at breakfast and dinner, the 3 EFAs pluses. She can take 1 at breakfast, 1 at lunch, 1 at dinner, and all that will be accomplished by 1 Healthy Start pack per month. I would also give her 2 of our Ultimate Daily tablets twice a day. And I'll tell you what all this means in a second. They'll take 1 bottle per month. I would like her to have 3 de-stress capsules twice a day. That's 2 bottles per month. And then I'd like her to have 3 selenium twice a day. That's 2 bottles a month. And lastly, I'd like her to have, at her body weight, 6 eggs a day. These eggs cannot be fried. They must be soft scrambled in butter, or they must be 1 minute poached or 1 minute boiled eggs. And hang on, I'll tell you what all these mean and what we're looking to do here after these messages. Back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for FDI Longevity and the 90 for Life Crusade. And Doug, let's go right back to Colorado and Barbara. Okay, so we got rid of all the bad stuff, and 1 Healthy Start pack per month. We want her again to have 3 of the de-stress capsules twice a day. That's 2 bottles a month. I want her to have 2 of the selenium 3 times a day. That's 2 bottles a month. I want her to have the Ultimate Daily tablets 2 twice a day. That's 1 bottle per month. And the 6 to 8 eggs a day. Very important. Now, the reason for all this, there's 4 different types of dementia, as we say. The first, most common type of dementia is vascular dementia, where there's nothing wrong with the brain. And because the arteries are plugged in the brain, there's not enough oxygen getting to the brain, causes dementia. Number 2 is what's called Korsakoff syndrome. There's nothing mechanically or physically wrong with the brain, but there's vitamins missing that are required for normal memory function to take place. Then there's Wernicke-Korsakoff, which is MS, multiple sclerosis, and Korsakoff syndrome going on at the same time. And then there's the most recent physician-caused dementia, Alzheimer's disease, which is a deficiency of nutrients and cholesterol. So this whole diet and the nutrient program is designed to deal with supporting and promoting healthy blood flow through the brain, supplying all the nutrients known to be necessary to support healthy metabolism in the brain, and lastly, to support and promote healthy maintenance repair of all the tissues in the brain, including the myelin, the cholesterol-containing structures in the brain. And we've seen really superior results in the nutritional approach with all 4 of these dementias at the same time, as opposed to the various drugs that are used by prescription. Because none of these drugs do anything for the metabolism of the brain or the health of the physiology of the brain. The pharmaceuticals try to mask symptoms. And, of course, that doesn't solve the problems. So I'd urge you to, Barbara, get a hold of your FDI Longevity Associate and, get them to help you with your mother-in-law. And I apologize, we only have a moment left here, and the odds are we won't be able to finish if you had a second question about yourself. Did you have a second question about yourself?
Yes, I wanted to ask about, my doctor wanted me to have a rectocele, and I wanted to know what I could do so I don't have to have that surgery.
Okay, why is that? What do you have? What's the problem?
I have my rectum is bulging into my vagina.
Okay.
They want to tie up my uterus. They want to take my uterus out. They want to fix the bulge, and they want to tie up my bladder. And I'm not incontinent. I have no problems with my bladder.
Okay. All right. Well, this is going to be a little complicated answer. So what I'm going to ask you to do is call again. We'll put you near the top of the list. Okay. And we'll go over that one. But yeah, I would at least cancel or delay the surgery and give us a chance to give you a natural approach to dealing with these pelvic structure collapses. There's ads all over TV about reconstructive stuff going bad. They're going crazy with this pelvic reconstruction. And so we want to give us a chance. Give us 90 days. We'll go over the details of that next time you call, and we'll put you at the top of the list, okay?
My mother-in-law off all the statins?
Well, yeah, that's true. How many statins is she on?
She's on 2.
On 2. Well, I would talk to the pharmacist and see if there's anything in the notes in the PDR, the physician's desk reference, about those 2 particular statins to see why she can't just cold turkey off of them. You know, maybe one of them she has to wean off of, the other one she can cold turkey. Maybe both of them she can cold turkey. But I would have the pharmacist give you the printout and that so we know what we're doing here, okay?
All right, thank you.
Oh, you're very welcome. Well, thank you, everybody. Really, really great questions and testimonies. Say thank you so much, Doug and Easton. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.